When we were going through the neurology rotation, there was always a lot of discussion about what is the diagnosis, and I like that aspect of it. There's a lot of brainstorming, literature review, because I think so much is still unknown. I really like that aspect about neurology. And movement disorders in particular, there are some conditions that cause the symptoms of Parkinson's, but they aren't actually Parkinson's disease. If you add all of that up, that's about half the patients that we see. And the other half, they have other kinds of movement disorders, tremors, ataxia, gait problems, muscle jerks, tics, Tourette's. It runs the gamut. I think the most important thing is to really get to know the patient, to figure out what aspect of their symptoms is most bothersome. As an example, some people are very anxious about maybe it's a poor prognosis, so there's kind of a more of an intellectual question, and then some people are very physically impaired by their diagnosis. So for them, it's more about how can we optimize the treatment. So I think patients have different goals coming in, so it's important to understand what they need and what they're hoping to get out of the visit. It depends on what the condition is, but there are a lot of symptomatic treatments for the movement disorders that we see. For instance, for Parkinson's, there's a huge range of medications that can reduce the motor symptoms. It can treat the cognitive side effects, the mood disorder side effects. There are a lot of treatment options, and it's hard to sort through them. So that's part of the reason why people come, is to get some suggestions, some expertise on what is the best way to use all these tools that we have. And at some point there's a transition or consideration of maybe it's time to consider a surgical procedure, and that is really one of our strengths here. I really enjoy building long-term relationships with the patients when possible. Talking with patients and helping explain the diagnosis to guide people through a difficult diagnosis, that actually is my favorite part of being a doctor. I'm honored to be able to work with our patients.